I'm Dr. David Thomas. I'm a practicing psychotherapist with the Whitford Thomas Group in Tampa, Florida, to discuss high anxiety symptoms. High anxiety, at least in my frame and my thinking, is an extreme form of anxiety. We tend to see that when we diagnose panic as well as anxiety attacks. So if we look at high anxiety being a more severe form of anxiety, you can kind of liken it to all your anxiety symptoms that oftentimes kind of come and go or kind of transient, tend to kind of emerge all at one time in the system. What are some of those symptoms? Well, certainly when we look at anxiety and we talk about fear, there's a rush, a kind of a hyper sensitivity in the system. Oftentimes what you see is the heart, the palpitations tend to be very fast, kind of a racing heart, racing ideas, skin moisture, tend to see a lot of tension in the head, muscle aches, stomach problems, restlessness, sleep disorders, a sense of doom, a sense of wanting to run, isolation, concentration issues and things of that sort as well. So when we have this kind of heightened or this kind of high anxiety symptoms, it's almost like all these symptoms kind of merge at one time in the system and produce a very severe or dramatic effect. Treatment-wise, it's pretty much the same, cognitive behavior psychotherapy with or without medications. At that time when you're experiencing a high level of anxiety, you probably want to learn different breathing techniques, relaxation techniques, so you can very quickly bring the symptoms down. With a little bit of work and help, you can certainly focus on the thinking that drives the anxiety, but without some prior training, it's kind of tough to focus on challenging and disputing the thinking at that time. We do that mainly in our practice with cognitive behavior psychotherapy. Well, I hope this information has been helpful regarding high anxiety. From Tampa, Florida, I'm Dr. David Thomas.
Hello, I'm Alex Mauskop. I'm a neurologist here in New York City, and I'm the director of the New York Headache Center. Nerves cover the entire body. There's no spot in your body that doesn't have nerve endings. That's why we have good sensation. When you touch someone, you feel the touch. And so there are two major kinds of nerves. One is the sensory nerves that allows you to feel things, heat, cold, touch. And there are other nerves that move your muscles. That is, nerve comes from the brain through the spinal cord and to the muscle, and the muscle contracts. So your brain has to give the order. So nerves can be damaged by a variety of conditions. There could be an inflammation of the nerves. There could be compression of the nerve, which often results in a painful condition called neuralgia. Inflammation of the nerves often occurs due to viral infections, or sometimes for no apparent reason. We sometimes cannot diagnose why some people have what we call peripheral neuropathy. So peripheral neuropathy can occur from well-known conditions such as diabetes, can cause peripheral neuropathy. Alcoholism can lead to deficiencies that in turn can cause nerve damage. Deficiencies in vitamins such as vitamin B12, thiamine, and other vitamin deficiencies can cause nerve damage. Nerve damage can occur from pressure during surgery or from sleeping on the arm when you're drunk. We have a funny term for that. When you have pressure on this nerve and you sleep on the bench, we call it Saturday night palsy. People often drink too much and they fall asleep on the bench and they exert too much pressure on the nerve and they have difficulty moving the hand. Usually that recovers pretty quickly.